In functional medicine, one of the most common causes we see for many health disorders is imbalanced blood sugar. An imbalance in blood sugar is blood sugar that is either too high, too low, too high, and too low. Let's just call it dysregulation. This can cause or contribute to all kinds of health issues from depression, anxiety, hormone problems, and dementias. This is part of the reason Alzheimer's is often referred to as type 3 diabetes. They can also cause brain fog, energy issues, and autoimmunity, just to name a few. So having a powerful tool in combating this process can be a game changer. This botanical tool may be berberine. According to the CDC, nearly 84 million American adults, more than 1 out of 3, have prediabetes or metabolic syndrome. And we see that in our office all the time. My line in the sand is an A1C of 5.5. If you're from a 5.5 to a 6.0, you are pre-diabetic. If you're above a 6.0, you're diabetic. If you're above a 6.5, you're probably going on medications. Now, 90% of those people with prediabetes don't even know it, but they have some other symptom that often brings them into our office or some other functional medicine doctor, if you dare. Berberine is found in the stems, bark, roots, and rhizomes of numerous plants such as barberry, golden seal, oregano grape, tea turmeric, that's different than curcuma longa, and Chinese golden thread. Berberine has been used in Chinese and Ayurvedic medicine for thousands of years to treat digestive issues and infections, since it is also a natural antimicrobial. The extract has a deep yellow color and is commonly used as a dye as well. Now, recently, berberine has become known for its ability to reduce high blood glucose. By working at a cellular level, it helps move glucose, i.e. sugar, from your blood into your cells where it's most needed and can be used. Berberine also promotes healthy blood sugar levels that are already in the normal range. Now, berberine works by activating AMPK, adenosine monophosphate activated protein kinase. It's a mouthful. This is an enzyme that regulates how the body produces and uses energy. Sounds pretty useful. AMPK senses and responds to changes in energy metabolism on both the cellular and the whole body level. It regulates biological activities that normalize lipid, glucose, and energy imbalances. Some other AMPK activators you may have heard of are metformin, ALA, curcumin, omegas, ACV, apple cider vinegar, adaptogens, check out our store for some great ones, the link's below, certain mushrooms, ginseng, carnitine, cold therapy, and cryotherapy. Metabolic syndrome or prediabetes happens when AMPK regulated pathways are turned off. This triggers fat storage and burning abnormalities, high blood sugar, diabetes, and energy imbalances such as chronic fatigue. Now, depleted energy activates AMPK while excess energy inhibits it. In other words, high blood sugar inhibits AMPK while exercise and calorie restriction activate it. Intermittent fasting, anyone? So higher levels of AMPK equals good. Berberine increases AMPK equals good. Berberine's effects are similar to what you'd see in someone who increased exercise while restricting calorie intake because it activates AMPK, making it a useful tool in the management of type 2 diabetes. Berberine is as effective as metformin in many studies. Other known AMPK activators include resveratrol and the drugs metformin, which we already talked about. Berberine is so effective at balancing blood sugar that both animal and human studies have compared it to metformin in its effectiveness. And this isn't the first time that man has tried to copy nature. And they didn't do as good of a job, in my opinion. But that's a different topic. And berberine has also been shown to be as effective in treating other conditions that respond positively to metformin, including PCOS, polycystic ovarian syndrome, the reduction of weight gain triggered by antipsychotics, and potentially cancer. Now, while berberine is most commonly considered for metabolic syndrome, inflammation, and cancer, it's potentially helpful for a long list of other disorders, including high cholesterol, obesity, SIBO, small intestinal bacterial overgrowth, leaky gut, lung inflammation, Alzheimer's, and heart disease. Below, are a list of other functions of berberine. It can support healthy blood cholesterol levels, it has antioxidant and anti-inflammatory qualities, it has a moderate weight loss effect, like we talked about. It can exhibit antibacterial qualities, which is why we often use it in gut issues, and it can reduce the effects of tobacco smoke-induced lung inflammation. It can also inhibit growth and proliferation of cancer cells. It enhances neuroprotective factors, stimulates the release of nitric oxide, a signaling molecule that relaxes arteries, causing vasodilation, and it can protect against atherosclerosis, or hardening of the arteries. It can also stimulate bile secretion and bilirubin discharge, which is gallbladder function. It can also reduce dysfunction of the intestinal mucosal barrier, helping leaky gut issues. So how much berberine should you take? For diabetes and blood sugar support, the recommended dose is 500 milligrams 2 to 3 times per day. Now it's important to spread out your dose throughout the day because berberine has a short half-life in the body, and taking it all at once might rob you of the full benefits, and you can only absorb so much at once, so spread it out. Now generally you want to take your berberine before or with a meal. Low and slow wins the race. Studies show that gut bacteria do play an important role in transforming berberine into its usable form, so gut function is important. Therefore, supporting microbiome diversity and abundance is a smart way to increase its effectiveness. Make sure to eat a variety and plentiful produce, go easy on the sugary fruits, and consider supplementing with short-chain fatty acids to help your gut bacteria thrive. Of course, pending your doctor's recommendations and stool analysis results. So how long should you take berberine? Well, continual use of berberine can impact cytochrome P450 enzymes and the liver, which can affect how drugs interact. Therefore, it's recommended to use it in a pulse of 8 weeks, with an 8-week cycle on and a 2 to 4 week cycle off. Start again, see if your symptoms have resolved or not. Research has shown that combining berberine with cinnamon can increase its bioavailability, or basically its effectiveness. What's more, cinnamon has also been shown to support insulin sensitivity. Check out our link for glucose support, which is our supplement that we use for this. Yes, shameless plugs. So while berberine is highly recommended for high blood sugar issues, it does come with some cautions. Berberine is considered unsafe for pregnant women and nursing moms. It can cross the placental barrier during pregnancy, and some newborns exposed to berberine did develop a type of brain damage. It can also be transferred to babies through the breast milk. It's unsure what this will cause. In addition, berberine can interact with a number of medications, increasing the risk of adverse reactions. This has to do with those P450 enzymes that we talked about in the past. Now, taking berberine when you're on medications that reduce blood sugar can further reduce your blood sugar, causing a hypoglycemic issue, potentially causing you to pass out. In a similar way, berberine can lower your blood pressure. So used in combination with somebody or someone that is already on blood pressure medication may again lower your blood pressure too much, again causing you to pass out. So if you're concerned about your blood sugar status and want to discuss non-medical methods for helping regulate your blood sugar, contact my office for an appointment. The link is below. In the meantime, stay healthy, stay happy. I'm Dr. Craig Mortensen. I'll see you next time.